Salt keeps balance in our cells, helps nerves function and transmits signals correctly. However, dogs should only eat it in moderation. A deadly dose of salt is roughly 1.5 grams per pound of body weight. Whilst that sounds like a small amount, if you're feeding your dog salty foods or if they eat a salt shaker, it's easy to overdose. If you want to know what other foods are deadly, check out our free handout. Whilst salt didn't make it into our top 10 most poisonous foods, too much of this substance is toxic. If your dog eats salt, they will naturally drink fresh water to reduce the effect on their body. However, if they don't have access to fresh water, or if your dog ate too much, they will be poisoned. When this happens and there are large amounts of salt in their blood, it's called hypernatremia. Muscles will shrivel and stiffen, which causes shaking and spasms. It will also wreak havoc with your dog's neurological, gastrointestinal and cardiovascular systems. Your dog might experience extreme thirst and urination, weakness, dizziness, headaches, confusion and a high fever. They might also develop gastrointestinal problems like diarrhea, vomiting, abdominal pain and nausea. Your dog's tongue may swell. They might have lost their appetite, become lethargic and start fainting. They might have fluid buildup, respiratory distress, convulsions, and in some cases too much salt can lead to death. When you get to the vet, they'll ask you questions about symptoms, what your dog has eaten and timeframes. Be prepared with answers, as this will make it easier and quicker to diagnose and then treat. Remember, it's not just food that contains salt. Products like Play-Doh, which have a high sodium content, are a real risk to your dog. It's always handy to take a photograph or a piece of whatever your dog ate. It will give the vet a better understanding of what's happened. It's best to act quickly if you think your dog has eaten too much salt. Call your vet as soon as possible to reduce the chance of salt poisoning. If your dog has been poisoned, it's essential to keep them hydrated. Your vet will probably give them IV with fluids and electrolytes to help your dog's body fight the toxins. Over the next few days, your vet will stabilise the salt levels. If you lower the salt levels too quickly, it can cause a heart attack or brain swelling. Additional treatments might include a radiograph, an EKG, an MRI, a CT scan and an ultrasound to check your dog's organs are all functioning correctly. They will also check for any damage to the heart, lungs or brain. After being treated, your vet might recommend giving very bland dog food to your dog. It will be easier to digest and less likely to upset the stomach. Make sure your dog has access to a lot of water as well. To request a copy of our handout, email handouts@puppyclassroom.com, and to inquire about our range of dog foods, email team@designerdogfoods.co.uk.